And at this point, we're also going to go through some initial comments that we need to make, if I may, Mr. Chairman. Today's meeting was not posted 48 hours in advance, and that we could not have reasonably known of the topics of discussion 48 hours prior to this meeting. The topics to be discussed are essential since they deal with a public health emergency, and the board could not wait for the posting 48 hours in advance of the meeting. This meeting is being held virtually through Zoom. People that join the meeting are set so their microphones are muted, so that the meeting can occur in an orderly fashion. We ask that people who join keep their microphones on mute so background noises do not interfere with the meeting. Should any member of the public wish to speak, we will be discussing, the chairman will decide whether or not we will have a question and answer period. It's possible we may not have a question and answer period. We ask that public use the chat box to let staff know that they would like to ask a question, and staff will monitor the chat box and inform the chair of individuals that are seeking information. Upon speaking, we request the microphone be placed back on mute. Again, folks, it's possible that we will not have a public comment section on this meeting, but I defer certainly to the chair of the Board of Selectmen on that. We have a lot of business that we want to conduct, and we have a number of public officials on this line and need to go through our business as quickly as possible as everyone has time constraints. On behalf of the board, I'd like to greatly appreciate and recognize that we have Rep. Arciero on the line, Congresswoman Trahan on the line, and I know that we're expecting Senator Eldridge. We thank you so much for being here with us. Joe, I'm going to turn it over to you, if you don't mind, Mr. Chairman.
Broad. We responded to the facility 18 times since Friday for sick individuals.
Yes.
We've transported 16 patients from that facility out of the 18 responses. They've gone to Emerson Hospital and the Neshoba Hospital. We continue to respond and support, and we will continue going forward. At this time, it appears that they do have a larger than normal request for service, and we have attempted to get that facility some additional assistance.
Thanks, Chief. Where do we want to go from here? Other topics?
I think if we could, speaking to the Assistant Town Administrator who's coordinating this meeting on Zoom, if we could just unmute Representative Arciero, Congresswoman Trahan, and Senator Eldridge. Oh, he's unmuted. That's great. Mr. Chairman, through you, I would ask if there would be an opportunity to hear from them, and for the board to have an opportunity to exchange and discuss with them any comments or concerns, or I know that the goal of this meeting in general was to discuss ways in which we can assist with Life Care Center and their needs in this time of a very difficult pandemic.
Nina, I'd like to open it up to all of them. They can speak whenever they want.
Thank you. Can you hear me? This is Lori Trahan. Can I ask a couple of questions?
Well,
Thank you. So first of all, thank you, Nina, for pulling us all together. We learned of this situation with Life Care yesterday as it was developing, and I just want to thank the chief for responding so quickly. I think some of my concerns right now are for the existing seniors who are at the facility, what the status of their care is, what if we have any visibility into the staff that are working at Life Care, how many of them have tested positive, if there's enough staff. I've been in contact with the National Guard because they've got a mobile testing unit. They've obviously been handling the soldiers' homes in Holyoke and Chelsea, and they're prioritizing a visit to Life Care today. But I just want to get a sense of what the current situation is, if we have visibility, and who from the administration, from DPH or HHS are descending on the facility today.
mm-hmm.
I know that Scott is unmuting himself. I think he's the best person to begin answering that question. Thank you, Chief.
Currently, we're responding to the facility, and as we respond, we're sending it. We're taking our full precautions for every response at the facility, and at this time, we have very limited access to that facility. We go in, we retrieve our patient, and we leave with one individual and nursing assistants.
F3. F3.
The response and typical observations on the inside appear to be normal for the exposure that we actually have there.
So has anybody besides the town actually had a briefing with the management team at this facility? Do we know, what is being done to safeguard, or is that all in development, I guess, today?
We've had conference calls with Neshoba Hospital, with the local Board of Health, as well as DPH.
Okay.
DPH was also involved in a phone call yesterday afternoon, and the representative from DPH is dealing directly with that facility.
Okay. That's helpful. Thank you. I can't even imagine the anxiety of the fire department having to go in to such a site, protecting themselves while also taking care of folks. So we're grateful for your answering the call 18 times. I think, with Representative Arcero and Senator Eldridge, we have some work that we can do jointly. There's already an open investigation with CMS, which is their, funding and regulatory authority that we're going to, log a complaint to. I mean, my utmost concern are the people who are in their care, as well as the other facilities that are nearby, like in Acton and Fitchburg, making sure that they're being forthcoming and transparent about what's happening inside the walls of these facilities. And additionally, I think we can also draft a letter to the CEO demanding some answers to these questions. So appreciate you sharing with us what you know. And if you think that there's anything else that we can be doing to kind of move this ball expeditiously forward, please let us know.
Thank you. Appreciate the support.
So good morning, everyone. This is Senator Jamie Eldridge, and glad we could all be on the call. Thank you so much for organizing it. And Chief, I know you and I spoke yesterday after Jim Arciero had called me. And I'm just wondering, sort of to follow up on the Congresswoman's questions, are you in direct contact with the executive director at the Life Care Center and in conversations with any of like the senior staff for the Life Care Center? Because there's some concern that they weren't taking proactive measures and they haven't been transparent. So are you in direct contact with the staff or senior executives?
We were in contact with during those conference calls with staff that were on site.
Okay.
Unsure of the level of or their positions within the executive portion.
Okay. Okay, sure. Is there an executive director that's at the location now, or?
I believe there is. I'm unsure exactly if they're on site right now.
Okay. Okay, thank you.
Hi guys, Jim Arcero. Sorry, I had a little bit of technical difficulties in the beginning. As you can see, I had some assistance from Congresswoman Trahan's office. Lori, I don't know if you know that, but I did, and my wife. But yesterday, I got the troubling news, probably about 8 o'clock in the morning, from the police and fire chiefs in Littleton. And Senator Eldridge and I worked with Mary Lou Sutters in the Massachusetts Command Center on COVID-19 to make sure the DPH was working collaboratively with you guys. And it, you know, as we've started to unfold this whole story since I believe Thursday, Friday, and the 18 calls, it's, you know, obviously very disturbing to us that, you know, these are people's mothers, fathers, sisters, and brothers that are there, and to my understanding, you know, a number of deaths and people that are infected. I guess my question, and you know, Scott, we've had this conversation yesterday too, is what is the actual status at the facility right now in terms of? We talked yesterday a little bit about how there's people that are showing serious symptoms, and there's kind of I don't want to say a breakdown in communication with Life Care Center, but they're not necessarily forthcoming with the information about who might have symptoms and how many people, you know, are on the verge of being very sick. So I don't know if you could answer that, Scott, at all.
Unfortunately, we did reach out to the facility this morning for a status check, and we were unable to obtain any information.
Okay. Well, that's very concerning for me. I know there's always, you know, and I know the Congresswoman and the Senator, I think we all collectively agree that there are things that we can do. Certainly, I know the town of Littleton has done everything to save human life, right? And I applaud you for that and all your efforts. But I know it's frustrating for you know, our first responders to continue to go to a place that I think some of the words that were used yesterday, Scott, were sort of like an infected cruise ship, if you will. A situation where there's just multiple people that are sick, and this is, you know, these are the stories we see on CNN every night that need to get rectified, and I'm just blown away that Life Care Center has zero plan. So I think myself and the state senator and the Congresswoman are going to take action to make sure we get these people protected.
One of the issues, granted, if they may be sick, if there are a large number that are sick, the question is, where would they go without overwhelming our healthcare system and the local hospitals? So that's really a larger concern, and you know, to be able to offer the assistance, but again, where would we take them all if they were in a significant number?
My bigger concern too is the fact that there's people for the last 6 or 7 days that have been working there. They have no idea that they could have contracted COVID-19, and where are they going? And so I don't know. I have some serious concerns about this organization's leadership.
So, Jim, I actually have a question on that point, because I think it's a really good one, and perhaps someplace where we collectively can intervene. How are employees being tracked? Right now, is it just at the Board of Health level in each community? What do we know about the employees that have worked there? What do we know about what communities they're in? What do we know about their status in terms of infections and things like that? And how is that being coordinated?
Jace, I think this goes back to transparency, like Senator Eldridge and Congresswoman Trahan said. And Scott, I would have to turn that back to you. They haven't been forthcoming with information. Is that correct?
It's very limited information. The information that we have received has been from the Board of Health.
Okay.
So if I could just add one thing here, I mean, Secretary Sutters has been pretty explicit in terms of the hotspots in Massachusetts that they're closely monitoring right now are our senior living facilities, right? That's the making sure that they have proper protocols. You know, since learning of this news, we actually called a handful of them to see how they are tracking and monitoring their staff and their employees going in and out. And I have to tell you, the variation is frightening. So us passing along this information directly through to the state and to the National Guard, which I know is stepping in, and also to the point that you made, Scott, where do we take folks? We actually, there's a place, we've got overflow facilities right now for folks who we are going, you know, to quarantine at the Cape and Boston and Worcester and Springfield. We actually don't have one in this part of the state, but it's likely something that we're going to have to surface as a need here, especially if there are going to be folks from this facility that need to be taken out and dealt with separately. Do we have any indication of the 16 people who have been transported to Neshoba or to Emerson and have been tested, what those results are? Do we have a feedback loop on that?
I do not. We have been made aware through, again, through the Board of Health that 3 of them have confirmed positive. We don't know any additional status as far as.
It would be helpful if as those tests come back, if the local Board of Health could make us aware, just so that, you know, we can understand, you know, just how widespread this issue is. I'm sure there are countless others who are deserving of a test at this facility. My hope is, and I spoke to Colonel Margaret White, who's a member of the National Guard, but also works directly for the Secretary, about getting their mobile testing unit dispatched to this facility immediately. So as Representative Arcero said, there's definitely too many questions left unanswered by this company. That is a national company from Tennessee, and we're going to push that issue to make sure they've got protocols in place. Attorney General Maura Healey's already on this as well. She understands that there are other centers across the Commonwealth that could be in the same need as this one in Littleton. But to the extent you all can send information as you receive it to us so that we can, you know, make sure we're mitigating this disaster as best we can and putting a spotlight on it so that other care. I have one other question, actually. Are there other privately owned senior living facilities in Littleton that we should be checking in on?
No, there are not.
Okay.
There is a life care center in Acton as well, which I've been checking up on, and so far I haven't heard anything negative, so.
Great. Thank you.
Scott, can I jump in and ask another question here? What kind of strain is this currently putting on the department's PPE resources, and how does that change going forward if what seems like a hotspot actually develops into a hotspot? Because we've got competing top priorities here, keeping the people at the facility safe and caring for them, but also caring for and making sure our first responders are not put in any more risk than they are already undertaking.
So currently, with our PPE, we've received 2 shipments from the National Guard. We've been very appreciative. We've been going through MEMA to obtain those. We received a small shipment this past Saturday, and then again on Tuesday, I believe, Tuesday morning, we received additional supplies. We should be at this current rate probably good for 2 to 3 weeks anyway. Obviously, depending on our responses. All of the members here are in full PPE. That includes a Tyvek suit, booties, gloves, N95 mask, face shield, and after every single run, they are deconned. The ambulances are deconned, and then electrostatically sprayed with virus killer. And so once that is complete, then we'll be ready to cycle in for the next call. As far as the response to the facility, they've typically gone back to back. So we may do two at the same time, and the facility has at least given us the heads up when there's an additional one in the queue. Once we're done with the decon procedure, we'll head back to the facility for the next transport.
So I'm glad you mentioned that, Scott, because that was something I noticed out of the logs, that it seemed like things were back to back, and you just confirmed that. Is your sense that they're waiting until things are dire to transport patients, or are they being fairly proactive with contacting you and transporting patients out?
No, they've been in touch as the situations evolve. One of the things that they've been finding is that these patients crash rapidly. So as that occurs, they're notifying us right away, as well as the doctor and the receiving facility, and we're called.
So does that mean that they're attempting to provide care at the facility until the point that you need to get involved and transport them out?
Unfortunately, they crash at such a rate that it just goes beyond their capability of caring for them, and they need to be brought to a facility that can offer additional care.
And when you're in there, can you comment on what you see in terms of how they are managing and caring for patients who are showing symptoms, understanding that, even our health agent isn't getting the access that he needs and wants, but are they segregating people? Are they segregating staff? Do we have any sense of that based on your visits?
There is no means of segregation in that facility. That's one of the concerns. So at this point, we are considering everybody hot in that facility. So we will take full precautions, full PPE on everything that we do within that facility. I cannot personally say what has been observed inside there. I have not been in the facility since this has started. We, in our members, like I said in the beginning, we're only sending in one individual with the stretcher and assistance from their staff to assist in removing the patient out of the facility into the ambulance.
Okay, thank you, Scott.
Scott, do you have any idea how their staffing level is?
I do not. Again, personally, I have not been inside, and I cannot confirm anything on their staffing levels.
I'm trying to find it, but I think it's on.
Now, Scott, when we had the discussion yesterday morning, your fear was that their staffing was compromised in a lot of ways. Is that correct? Like the ones that could do direct care, or the LPNs and various nurses or RNs, right?
The CNAs, we did hear that several of them were out sick.
Okay.
And some, if I may, this is Chuck, some have actually left the organization, from what I understand. And I know that Chief Bernard is working on getting a hold of one of the individuals who is from Littleton to maybe garner some information, try to find out some intel, frankly, almost like an investigation. The other question I had was, and our legislators may be able to help us here, is how we can escalate this. If they're not getting us answers and there's a state of emergency, or what steps do we need to take in order to escalate this? And if we are looking to have the National Guard to come in and support us, can they close the door and say, no, you can't come in? I mean, where are we at with that?
Mm-hmm. Yeah, it's a great question, Chuck. So I think that's in, Jim and I put in our inquiries to Secretary Sutters and her chief of staff, yesterday morning after we talked to the chief. But yeah, who has the power here at the state or federal level to intercede with the Life Care Center? So we definitely have to get that answer. It sounds like from what Congressman Trahan said is that the National Guard coming today with a COVID-19 testing to the facility? Is that correct? Or I don't know. Emily, are you still on the line?
When I spoke with the National Guard yesterday, they said that we were listed as a high priority, and they were ready to assist the facility, but the facility needed to give them the okay to proceed.
I mean, there's got to be some overriding of
Somebody you can estimate
the
to,
director, you know?
whether it's the governor or
Yeah.
if Congresswoman Trahan can pull
Working
it
on
back.
unmute.
So, sorry, the Congresswoman had to jump off for another call. I apologize. This is Emily Byrne. I'm her district director. So I do know that she did speak with Colonel White as well as Colonel Keefe yesterday from the National Guard. We will make sure to circle back, but they did indicate that they were trying to come to Littleton today to provide additional testing. They have a mobile testing unit.
Right.
So we will circle back on that. Sorry for the delay. I couldn't unmute myself. But that is certainly a follow-up item that we will certainly push on. I think, the other thing, as the Congresswoman said, we, are well aware that CMS, which is their funding source, it was investigating the same agency for issues in Washington State, and we're aware of other issues in other states. So we are going to certainly put some pressure on there because there are investigative sources there. But additionally, we are going to, work with the Attorney General and potentially do a letter with our state delegation here to the CEO. But I hear your concerns, and we will continue collectively. As we always say, our voices are better collectively than on our own to advocate with the governor's office about this issue in Littleton and make sure it's a priority.
And if I could just ask a couple questions to the chief again, is just because just trying to understand the specifics, is what is the understanding as of today about how many residents there have died from COVID-19? Is it one or is it more?
Honestly, I can't confirm.
Okay.
The only that I've heard from the Board of Health was that one was confirmed with COVID. Unsure of the others for the, I guess, lack of testing results.
Okay, sure. Okay, and then I guess my other question is, in terms of the actual site, is there any oversight of who's going in there? And I assume that there's no visitors allowed. I just want to make sure that no one outside the community is going to get infected. Is there any actions by the Life Care Center or the town or?
The facility has been closed to all visitors and family members for 3 weeks.
Okay. And is there signs in front or any notice just to anyone that might not know that and come by, or?
No, all of the doors in the facility are locked. The only entrance is through the front, and there are signs on the front door.
Okay. And then my last question is, just because, I work with this with the town of Ayer, where, the second person in Massachusetts died from the coronavirus, a woman in her 50s, is the town putting something on your website announcing that this has happened, or what is the public notice?
The question, Senator, was regarding the Life Care Center. I'm sorry, I was coordinating other logistics on this call.
No, that's okay. So aside from the Life Care Center, obviously, a resident of Littleton who because the person lived at the Life Care Center has died from the coronavirus. So is the town posting information on its website? Because Ayer, when a person in Ayer had died, the town of Ayer posted on its website. So I'm just curious what the protocol is.
Chief, I can take that in part, and I don't know if you want to expand on it or if members of the Board of Selectmen would like to at this point. But with regard to the Life Care Center, we do have a press release that went out very late yesterday evening to advise residents, and it was posted also to our social media platforms.
Oh, okay. And that's on the website, or?
Yes.
Okay, thank you.
If I may, Mr. Chair. I'm sorry.
I'm sorry. Go ahead, Cindy.
No, that's all right, Scott. Actually, this might be directed towards you. So based on the update we just received that family members and visitors have not been permitted into the Life Care Center for the past 3 weeks, I'm really concerned about the patients inside and their ability to communicate with family and family to check on them. What can we do?
Mm-hmm. Yeah.
In this type of situation? I mean, personally, having just gone through this with a family member in a rehab center, and appreciating the need to be able to communicate with them on a regular basis and check in on them, given these circumstances. If I had a family member in there right now, I would be incredibly worried and upset. Do we have any mechanism or suggestions about how we can maybe connect with those family members and get them in touch with the people that they need to communicate with on the inside if they're not cooperating with us?
I do believe that you still have communication, phone communication to loved ones within the facility.
But what if they're not able to communicate by phone due to their medical condition? You know what I mean, Scott? I just...
Unfortunately, I'm not able to answer that. I don't.
And I didn't expect you to. I'm just putting it out there. It's just another layer of concern with this situation.
But Cindy, what it gets to is, I think, the fundamental crux of the issue. When do we stop asking them to do things, and when do we start telling them to do things? It would be great if they cooperated. They're clearly not going to cooperate. So
right.
I guess the ask right now is Congressman Trahan's office, Jim, Jamie, we're going to need help telling rather than asking.
Mm-hmm.
Well, I think
absolutely. Yeah. Go ahead, Jim.
I was going to say, I think some of the takeaways from this meeting and the conversations that we had the last 36 to 48 hours have one been about the Attorney General's office, and Congresswoman Trahan and Senator Eldridge and I have had preliminary conversations about bringing her to investigate the facility, number one. Number two, I guess my question, sorry to be a question with a question, but how has DPH, Chief, been for you guys over the last 48 hours? I know when we first spoke, you were somewhat frustrated, which I totally get. We've talked to their office, the Senator and I, and they have told us that they are following protocol and working with you guys. So we're just making sure the Baker administration is giving you the resources you need so far. I know that the National Guard is on the way, et cetera. So first and foremost, we want to work with the Attorney General's office, to your point, Chase, in terms of oversight and making sure people are protected, number one. And number two, I throw a question back to the Chief to say, how has DPH been working with you? They're telling me through multiple phone calls that the Senator and I made yesterday, one of them to one of the top people in Baker's administration. And I know that Congresswoman Trahan had conversations as well yesterday with Baker's administration. So my question to you, Chief, is how has DPH been with you guys?
We've been dealing with DPH. Like I said, we had a call with them in the morning and a conference call in the afternoon. Right now, I would honestly defer to DPH as for all of the information that's being communicated through the facility.
But so far they've been. You feel confident? Like at first, I think yesterday when we spoke, it was, you know, deservingly so. You were very concerned, and you feel like that collaboration is improved.
Right now, again, DPH has the communication. I'm not sure if it's, which division of DPH and how they're following through, but they are working with the facility.
Okay. Well, Jim and I will follow up with DPH today, so thank you. Any other things?
I'll jump in here real quick, just it's more of a materials and product standpoint for Chief Wodzinski. You mentioned that you guys are doing decon on the guys and on the equipment and on the ambulances. Are you guys using BHP? Do you have enough of that? And whatever you're using for decon, if you're going out on 18 calls over a 5-day period, plus there's other calls aside from LCC, how are we set for whatever materials you are using, whether it's isopropyl or BHP or whatever aerosols or whatnot you're using? Catch me now?
I think
Oh, he's
Scott
still-
may have gotten himself muted. How's your sign language, Scott?
Yeah, thumbs up or thumbs down in the middle.
How about now?
Perfect.
Okay. As far as the solution that we're using the appropriate ratios through the electrostatic sprayer that's going through the ambulance, through all of our equipment. We're doing all of the entire fire station facility, as well as our police department and dispatch center as well. Running through that on a daily basis, and again, all of our equipment after every single run.
Okay, so we've got the materials in-house to be able to do that. We don't need to contact like a Steris or one of those contractors, because they're straight out as well with any private contracts.
Yeah, we do.
Okay, good, thank you.
And to everyone, I have two questions. If somebody has a relative that's there right now and wants to have them taken out, can they do that? Is there a policy on this?
I am unaware of any of the policies for that facility. The only thing that I'm aware of, we've had several calls that families have been contacted in a request to remove their loved ones from that facility, by the facility.
And what are your thoughts about what other towns have done, where they put out how many people in town have been tested positive, how many deaths that might be? I think the town of Chelmsford has stopped doing that completely. I don't know what the thoughts of the board or your thoughts on this as emergency director are.
Sorry, that's as far as looking to get the information out about how many confirmations we have in town.
Yes, there's been a number of people that asked, how many do we have? How many known deaths do we have? Is it something that, is it a positive thing to do to let people know, or is it, I'm just asking the question because we've had that question.
I mean, I guess it would be a benefit, honestly, just to maybe know. It's not going to change anything within the community. As far as the state of Massachusetts, I know currently they are doing it by county. That's being put out every night, the updates. And I mean, you look at New Hampshire, and they're listing it by community. I know some of the communities in the state of Massachusetts have begun listing how many they have, but I think that they're doing it on a by town basis, and I'm not sure who has given the approval or how they've gone about doing that.
I'm going to jump in here, Scott, since you're still on the camera, and I think you're still unmuted. Well, first of all, just to address the facility being on lockdown, essentially, and having just the one entrance, it's my understanding that the police department has a detail at the entrance of the facility, and that's your understanding as well. So LPD has somebody out there. So for anybody that was concerned about that, hopefully that assuages some of those concerns. The other question I have is, since we have our legislators on the line, how satisfied or how happy are you with the DPH response?
Well, it's hard to measure when.
Actually, Jim, that was actually the chief's response.
Okay.
Just since you guys are on there, sorry.
Well, you said our legislator, so
because you guys are on the line, I just wanted to get
no
a reaction from him. Yeah.
No worries.
So you're asking how we're satisfied with the DPH response?
Yes.
We've reached out to them, and again, we reached out to the EPI line through DPH last night, and they were a bit more concerned than the individuals that we were dealing with earlier during the day. I'm not sure how or to what level they will escalate that, but we've reached out to everybody that we're aware of at DPH that could offer assistance.
And are they Have they come to the life care facility, DPH officials?
Not that I'm aware of.
Okay.
Just to chime in here, I know the Congresswoman had to jump off, but I did just ask her to follow up with Colonel White, who she's been texting with since last night about this, just to triple confirm that they do expect the National Guard to come there today. So if I don't have an update before this call ends, I will be sure to share it accordingly.
Mm-hmm. Thank you.
I mean, I guess I would say the one thing for us, and I'm sure Jamie and Jim would say the same thing, we will do anything we can to help and support you and advocate in any way, shape, or form. It's just important to, as you have some information that is shared with us, so that we're, pushing on the right levers with the right information to people. And obviously, I understand there's some information that cannot be shared widely. We aren't sharing information widely. We're all dealing with this, together, and we want to do the right thing and be in this together to help in whatever way we can. So I just want to make sure that as additional information does become available, or concerns rise to the top, that we are made aware, so that we can continue to help in whatever way that we can.
And Chuck,
Emily,
We're just not letting you talk, Jim, huh?
I know, right? Representative, go ahead.
no, it's really quick. No, I was just going to say, just Chuck, to your point, and I think to everybody here, the Congresswoman, Senator Eldridge, and myself were alerted about this yesterday. So I realized that the first responders have been dealing with this in DPH for the last 4 days. And I know it's been a trying effort, and it's been difficult, and in some cases very hard to see people in these situations. But I also think that the response to the chief's point, the response has improved over the last 36 hours, because we're all together in a team here, and we all have our boots on the ground with you guys. So I feel confident that we're going to continue to put a lot of pressure on these, on our resources to keep people safe here. So,
Thanks, Jim.
Emily, Congresswoman had mentioned overflow facilities, and that there are some in Massachusetts, but none in this direct area. Could you recap what she had mentioned about that? Because I'm expecting an influx of inquiries about from people who want to relocate family members who may be in the facility.
So I know that the state is working to set up overflow facilities. Some folks might have seen, I know the governor was out at the DCU Center in Worcester. I know that they were working on setting a site in Springfield, as well as at Cape Cod. And we are advocating that there is one set up here in the Merrimack Valley. Actually been talking about, even some possible locations for such, but kind of given this, issue rising here in Littleton, and the likely that more might come about, we will, I think, with Representative Arciero and Senator Eldridge, I think make that an additional priority in our conversations with the state, that now that this seems to be kind of a hot spot in the Merrimack Valley, that we need to prioritize an overflow site here.
Great, thank you.
And to be clear, when we're talking about overflow sites, we're talking about overflow sites for people who have contracted COVID, right? Not overflow sites for people who don't have a current positive test out of the life care facility, but otherwise want to leave there.
Yeah, it's overflow for COVID. Like, for example, I know we were on a call on Monday with Lowell General Hospital, and they actually have folks that have recovered, obviously are still positive, need a little bit more care, but they could be moved out of the hospital so that more space could be made for others in more demand, but there's nowhere to discharge them to right now. So an overflow facility of the nature that we're talking about in these regional locations would potentially help support a demand like that, so more critical care type patients could be going to the hospital where they are needed, and some folks with the, that are still recovering and need some additional care, but don't necessarily need to be in a bed in a critical care hospital, could move to facilities of this such.
That's helpful. Thank you.
So the gavel, Mr. Chairman?
Is there anything else to cover?
I think we all have our marching orders, so this has been a really productive conversation, if difficult one. So thank you so much for organizing it. Really appreciate it.
Do you guys want to reconvene at some point to at least sort of have a follow-up on all of our ends to come to sort of, where we are?
I would think that'd be very beneficial for us all.
We can
Coordinate a date and time in the future, offline.
Yeah.
And Nina, on the bottom of the screen, there's a lot of chat going on that I couldn't read because it was so small, but I think there's one person that's watching that might have somebody that's at Life Care right now that might want to contact our office for more information.
Yes, anyone who wants to contact our office, Mr. Chairman, can email us at selectmen@littletonma.org or contact us on our line, which we are monitoring and taking calls, especially during business hours. We're monitoring probably 24/7, but 978-540-2460. And in the case of the of one participant today, we did reach out directly and collect contact information and are going to be following up with them today.
Maybe just reply with that number in the chat box, just so folks can jot it down.
All right, do we need a motion to adjourn, or can we just sign off?
Motion to adjourn.
I'll second that, I guess.
Okay, board members, Mr. Glaber, you there?
He's muted.
Okay. Chase, you all set?
Aye.
Thanks, everybody. Appreciate it.
Aye. Thank you very much.
Thank you, everybody.
Very much.
Take care. Keep in touch. Bye.
Thank you all for your patience as we got. Really appreciate it. It's a little bit more complex sometimes than we imagine. And also apologies to anyone who had questions today. Again, please don't hesitate to contact our office. We're happy to try to answer any questions we possibly can or link anyone with resources if we have the ability. We're going to do everything we can to help the situation.
Great, thank you.